The KNH surgery mishap took a new twist today after sections of the media reported that the patient who was supposed to have the surgical procedure conducted on him had died. Claims that the hospital has moved to dismiss, with KNH Corporate Affairs Manager Simon Idhai saying that the two patients in question are still receiving treatment and have made remarkable improvement. Igathas saying that the late Angelos Miano, whose story appeared in one of the daily newspapers and on social media, referring to him as one of the patients involved in the unintended surgery, was not factual. This even as politicians drawn from the Rift Valley region allege mischief over various damning reports made over the referral hospital.
On the surgical operation on the wrong patient, this matter has been ably addressed by the professionals, both the nurses and doctors, who are governed by a code of practice. Mrs. Koros is the CEO dealing with administrative issues of the hospital and the board. It is far-fetched to imagine that she would be responsible, even more remotely, for matters of preparation of patients for surgery. There are professionals who are well trained and versed with these matters in the hospital and who have direct responsibility.
Led by Kericho Governor Paul Chepkwony, the leaders alleged that the rape case that was reported at the health facility was exhaustively dealt with by the Office of the Director of Public Prosecutions, and a hearing by the Parliamentary Committee on Health absolved KNH of any wrongdoing.
Of course, this is a witch hunt, and I said we are very categorical about it. This is a well-choreographed plan by tenderpreneurs who Lily Koros has been very firm on. We know about 3 tenders that come collectively to about 20 billion that is coming up in Kenyatta National Hospital. You must ask yourself, Lily Koros has been a CEO from 2014. Why the interest all of a sudden in 2018? If she was incompetent, then it will have shown from the year 2014. But because it is very clear that part of the 4 pillars of the president, health is going to have a huge budget, then many people now started looking at Kenyatta.
Chepkwony further says the sustained misrepresentation of facts in relation to the management is not only malicious but also undermines the goodwill enjoyed by Jubilee in South Rift.
There is a sustained effort from some of the factions, whether in government, politics, or private interest groups, to hound professionals from certain communities out of office and replace them with those favorable to them.
And following the suspension of Koros and her deputy, the Director of Clinical Services, KNH Board of Management has appointed Dr. Thomas Mutie and Dr. Peter Masinde as the acting CEO and Director Clinical Services, respectively. Caroline Kamar reporting for Channel 1 Weekend.